Hi, I'm Aravind Ganesh, and we're here to talk to you about Advanced Health Analytics, or AHA Health Limited. In between their clinic appointments, patients with chronic disease often suffer avoidable hospitalizations due to missed symptoms, ignored concerns of caregivers, and uncaptured trends. These cost Canadians over $3 billion a year. At AHA Health, we empower patients and caregivers using our secure cloud-based platform with real-time analytics. Our platform's assessments can be used to monitor any concerns like depression, caregiving stress, blood pressure, or glucose. And we're able to send alerts about any concerning trends to the care team so that they can carry out urgent outpatient interventions avoiding hospitalization. We're also able to provide advice to our users about lifestyle management, lifestyle modification, symptom management, and also locally available services. We'll also send a clinically relevant summary to the care team to inform their ongoing treatment plans. We are the only multimodal real-time analysis and intervention solution on the market using patient and caregiver-generating data, therefore addressing key blind spots of existing digital health solutions.
In keeping with our multimodal solution, our AHA Health team is multidisciplinary. Hari is a techie and a diabetes patient. Aravind and I have both medical and research expertise. John and Anojan round us off with his business expertise. So far, we have graduated from Oxford's Digital Health Incubator and have received one of 3 Springboard grants from the Wellcome Trust and MGH Partners Group to pilot our solution. We have also worked with the World Health Organization's Mobile Health Working Group to develop a framework for national digital health platforms. We've also received attention from corporates like Sanofi and Hutchison 3G, who have paid for a trial through their employee health and wellness program.
Validated by these successes, our business model is B2B2C, where the platform is free to use for patients and caregivers, but can be provisioned by hospital and clinic groups, insurance companies, or pharma companies seeking to engage their patients. We'll also monetize through leads from sales of relevant products and services like home care, assisted living, and even monitoring devices. Using the Innovation Award, we will complete formal usability testing of our platform, identify early adopter patients and clinic groups, and we'll also gather preliminary patient data on outcomes and identify third-party clients interested in being featured on the platform. Over the next 3 to 5 years, we'll integrate with EMRs and telemedicine companies to improve the seamless use of our platform and use machine learning algorithms to generate our own commercializable risk assessment models from patient data.
Ready to transform your healthcare? Support AHA Health and
Take this
dig
from the judges.
deeper.
Oops, sorry. John.
Thank you. So just a question. I saw a presentation from the health division of Microsoft. I've also seen Google Health that have, and Philips, who have also promoted some similar products. How are you going to outfox the competition?
Yeah, so I think the main issue that we've been seeing with a lot of the EMR companies and certainly some of the telemedicine providers is the focus on primarily physician-generated data. So the data is coming oftentimes, even with the Microsoft solution, to my understanding, it comes from kind of clinic appointments that the patients have or from engagements that they have with the system through lab tests or those types of things. The main blind spot that we're trying to address is that period of time where the patient isn't actually interacting with the healthcare system. And so they're at home, they're just dealing with their disease, trying to cope with it, patients and caregivers alike. And we want to use that as an opportunity to engage them better, figure out those patients that are deteriorating, flag them early, and improve care through that process.
So this is a commercial idea. Where's the commercialization of it?
Absolutely. So I mean, as we were saying, we did kind of rush through it, but it's kind of a B2B2C business model. So the idea being that the patients and the carers themselves wouldn't pay for this product, and ideally it's going to be provisioned by hospital and clinic groups or insurance companies seeking to improve patient engagement. So risk stratify patients into higher and lower risk categories, incentivize patients moving into lower risk categories, and also pharma companies. So the reason that Sanofi expressed an interest in our work is basically because with expensive chronic disease medications, the only way you're going to get patients to renew prescriptions is if they feel engaged in their own symptom management and if they feel that you're responding to their needs.
This question, does it require a team to coordinate communication between all those parties or high-value targets? Like, who's gonna be running this?
Absolutely. So the way what we've been working on with this platform over the last couple of years, and what we've succeeded in doing, is having a high fidelity background algorithm. All of this data is being analyzed in real time, and that's being sent automatically. So it doesn't actually have to be anybody in there, flagging these patients manually. It's all being done based on validated risk assessments and also targets and thresholds that we're setting, kind of in conjunction with the care team and the patient. So there's a patient portal and a caregiver portal where people can set their own preferences about symptoms that they want to monitor, about concerns that they want to monitor. But there's also a care team portal where the care team can go in. And as you can imagine, there can be different levels of engagement there, and they can decide what kinds of thresholds they want to set about when they want to be alerted, how they want to be alerted, those types of things.
Thank you very much.